What is brain inflammation and how can it be treated? So brain inflammation is a response to an injury in your brain. So your brain has an immune system, just like how you have an immune system in the periphery of your body. You have neutrophils and eosinophils and all these different types of immune cells. In the brain, you have glial cells and microglia and neurons, and they're all communicating with each other in a very specific way. When you have an injury, that immune system in the brain has to do what it needs to do to help you recover. But in some people, it keeps going, it keeps perpetuating, and it can kick into more inflammation as it gets turned on. And that's based off of a variety of factors. So when you injure your brain, your blood-brain barrier becomes more porous, and then you actually get changes in your gut barrier. And if you had a lot of inflammation in your body, that can actually make its way back up into the brain through the blood-brain barrier and perpetuate and keep this inflammation going. Hi, I'm Dr. Jeremy Schmoe, founder of the Functional Neurology Center in Minnetonka, Minnesota. We work with patients with unresolved post-concussion symptoms and other complex neurological issues. Our approach to complicated neurological issues is very different from other clinics. We use the latest technologies and a combination of functional neurology, functional medicine, and chiropractic care to get to the root cause of what is causing your problems. With this approach, we're able to get you back to optimum function and get you doing the things that you love to do. What is brain inflammation and how can it be treated? So initially the inflammation was good for recovery, but now it's continuing on, and then these glial cells, they're trying to recover you, but now they're going after good neurons. And then all these neurons are producing signals. So things start to get really complex. The basics of it is we have to cut down brain inflammation to help you get better faster. So we need neurons to be stable and we need to activate them. When we activate neurons, they actually produce signals that tell your immune system that I'm a good neuron. You need to leave me alone and don't get rid of me because I need to function to help make neurotransmitters and talk with other neurons to help kind of calm this cascade down. So you can decrease inflammation with nutrition. You can also do it with low-level light therapy. So we use zirconia cold low-level light laser and we shine that on the head. We also use molecular hydrogen. It's a small gas that you breathe in that has a high antioxidant capacity that can help decrease inflammation. And then we use PEMF, so pulse electromagnetic frequency on the whole body, and that can decrease inflammation, as well as hyperbaric oxygen. So there's a variety of different therapies that you can do to decrease that inflammatory cascade. But if it keeps going, that's what's going to continue your post-concussion symptoms, whether that's dizziness or vertigo. And take a neuron that's really unstable and inflamed, and if you put that, say, in the cerebellum, you might feel like you're still spinning when you're actually not. So we got to calm that down, improve the function of your nervous system, and that's what's going to get you better faster. There is hope. There are answers. Click the link you see with this video to schedule a consultation with my office today.